Hi, my name is Nicole Silverman. I will be giving a presentation on post-traumatic stress disorder. Brief overview. PTSD is a mental health condition that is triggered by a terrifying event. It can be experienced or witnessed. Symptoms may include flashbacks, nightmares, severe anxiety, as well as uncontrollable thoughts about the event. The study is relatively new, even though it has been around since battles were fought. 1 in 5 veterans of the Iraq and Afghanistan wars are diagnosed with PTSD, while 30% of the Vietnam veterans have PTSD. 40% of Iraq and Afghanistan war veterans have not sought mental health care because of the perceived negative impact on their careers. I talked to a couple experts about PTSD. First expert is Michael Long, or Dr. Long. As you can see, he has completed his doctoral internship at Vancouver Coastal Health, where he's worked with anxiety disorders clinic at the University of British Columbia. He is trained with leading international experts, and he also has done cognitive behavioral therapy in treatment of children, adolescents, and adults with anxiety and related disorder. Expert number 2 is Layla Franklin. Ms. Franklin has completed her doctoral internship at the University of Arkansas for medical science in Little Rock. Layla Franklin has experience with cognitive behavioral therapy as well as exposure and response prevention and treatment of anxiety, OCD, and the OCD spectrum disorders. Dr. Long believes the major contributions to PTSD is based on studies of the brain and how PTSD affects certain areas of the brain. As you can see, he believes in these changes are the hippocampus, anterior cingulate, amygdala, prefrontal anterior cingulate. Antidepressants have effects on the hippocampus that counter the effects of stress. That has been known. He further believes if certain areas of the brain have higher or lower concentration than normal, then this could be another reason why PTSD is prevalent in some than in other people. Dr. Long believes in not just pharmaceuticals, but going to therapy sessions to help the person understand and start the move-on process. The pharmaceuticals he usually provides are antidepressants or SSRI medications. Dr. Long recommends using http://www.ptsd.ne.gov for any additional information. Expert number 2, Ms. Franklin. Ms. Franklin believes the major contributions to PTSD is based on studies of the brain and how PTSD affects certain areas, along with psychological treatment. One of the treatments is cognitive behavioral conjoint therapy. This type of therapy helps people with PTSD be able to start to have relationship with friends and families. At times, she believes in couples therapy to help the individual and the family dynamic. At times, it is not just the individual with PTSD, but the spouse as well. Ms. Franklin also believes that acupuncture could help people with PTSD. Ms. Franklin recommends using www.apa.org for PTSD and additional information. The compare and contrast between Dr. Long and Ms. Franklin. Dr. Long believes pharmaceuticals are a major factor in helping treatment. difference in brain composition between PTSD and non-PTSD, further research into how the brain is affected by PTSD. Ms. Franklin believes in pharmaceuticals also, but also psychology treatments could provide better treatment. Further research into other non-Western medicines to help, just like acupuncture. They both believe in research into overall PTSD will help to provide a better treatment. Here are my references. This concludes my brief.